Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I am so excited to welcome you to episode 14 of the Ask Dr. Angela podcast. I'm hoping that this podcast finds you all well and having an amazing day. So I was in the office the other day working one of my evening hours, and that's a 12 to 8 shift for me. I hate evening hours because there's such long days. By the time I get home, my family's already eating dinner. Most of the time, my little girl's already, getting ready for bed, or she might even be in bed for that matter. The dog doesn't even come downstairs to greet me. It's just kind of a really long evening. But anyway, I was seeing patients the other day, and we have such a good time. Imagine having a really good time at your OBGYN's office. I had a patient in the room, and we were getting ready to do her annual exam. No one ever comes down far enough on the exam table. You know how you're lying down on your back, and, I kind of feel like I'm directing traffic or like landing an airplane or something, because I'm like, oh, come down just a little bit more, just a little bit, just a pinch more. And the patient and I had a really huge laugh about it because we're like, whoever comes down far enough for this exam? I mean, whoever really looks forward to a pelvic exam? And the more I thought about it, I thought to myself, what are some of the things that women worry about during the GYN exam? I have like the whole blog post that I do that comes out every Wednesdays, and I occasionally will do a top 10 list. And I thought, I got to do a top 10 list about things that women worry about during the GYN exam. And some of the things that I came up with are the following. Falling off the table. Who wants to fall off the table? I mean, would that be embarrassing or what? And then what about passing gas? That would be like so embarrassing, right? Although, I'm a GYN, so we see these things all the time. Or what about peeing during your exam? Oh my gosh. And then, of course, the other thing that I'm sure runs through people's minds is, oh my gosh, do I smell? In spite of the fact that you just took a shower before you came in, do I smell? And then it's like, do I look normal down there? Does my vagina look like everyone else's vagina? Do my vulva look like everyone else's vulva? These are just things that were kind of coming to my mind. And, the list goes on and on and on because I'm always thinking about 110 million things at once. So that list is going to be continued. So having said that and totally been rambling on and on, let's get to today's question, which comes to us from Rich. Rich, what do you have for us today?
Hey, Doc. My girlfriend is 7 months pregnant, and as we get closer to the end, I'm wondering what the risk is for preterm labor if she has a septated uterus.
First of all, Rich, thank you so much for this question. This is actually a really good question. For those of you that don't know what a septate uterus is, it's when the uterus, which for all intents and purposes can actually appear to be normal on the outside, has a piece of tissue or muscle that serves as a partition, and it can either extend just slightly from the midline and only partition or separate the uterus a little bit, or it can actually extend all the way down to the level of the cervix. Rich, the fact that you guys have gotten to what I'm going to assume is 28 weeks, because in my realm, i.e. pregnancy in the world of OBGYN, we tend to refer to pregnancy in weeks gestation as opposed to months. So when you say 7 months, I'm going to assume that you all have gotten to 28 weeks without any issues. And that's fantastic, because one of the things that we do know about septate uteruses is that they absolutely are associated with an increased risk of miscarriage, whether that occurs in the first or the second trimester. The other thing that we know about septate uteruses, as you said, is that there is an increased risk of preterm labor and delivery. The other thing that you should also be aware of is the fact that malpresentation or baby not being head down is also more common in women that have a septate uterus. I'd be very interested to know how exactly you all discovered that your girlfriend had a septate uterus, because as I previously said, your uterus can appear to be entirely normal on the outside. And We've had patients who were pregnant and ended up with a C-section, and it was only at the time of C-section, when we were actually operating on the uterus and examining the uterus, that we saw that there was a septum that was present. The other time where septums are diagnosed pre-pregnancy would be if there were any kind of fertility problems where certain testing, like an ultrasound or a sonohysterogram or a hysterosalpingogram, were performed. And those types of imaging would reveal whether or not there was a septate uterus. Having said all those things, Rich, the other thing that I will say to you is that even though you are at an increased risk, or not you specifically, but your girlfriend is at an increased risk for these things, she also could go on to deliver at full term and not have had any issues. Rich, I certainly hope that this answers your question and that you found this to be helpful. Thank you so much again for taking time out of what I know is a busy day to submit a question to the Ask Dr. Angela podcast. We will be reaching out to you so that we can get your information and send you one of our bomb-ass t-shirts. For those of you who are interested in having your question featured on the Ask Dr. Angela podcast, please visit my website and submit your question there at www.askdrangela.com. That's AskDrangela.com. If we use your question, we will send you one of our bomb-ass t-shirts. In bringing episode 14 to a close, today's thought of the day comes to us from Andy Rooney, who says, "Everyone wants to live on top of the mountain, but all the happiness and growth occurs while you're climbing it. Enjoy the journey, people." Looking forward to seeing you for episode 15. Until then, look better, feel better, be better. Dr. Angela signing off.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.